Hey, I'm Dr. Francine Wagner. I've been practicing medicine for the past 10 years. I practice primarily as a hospitalist, but I've been doing outpatient medicine for over a year, and that's about the time that coincides with the time that I started at Hatfield Medical. I think one of the things is that I establish a relationship with my patient. I try to get to know them on a personal level. And I think they realize that I do care. So when I make a recommendation, they know that I do care and I do have their best interests at heart. It's coming more from like a personal friend and not just some professional barking orders or telling you what you should and should not be doing. My patients have told me that I'm a very good listener, and I don't mean to sound cliche, but I'm also a very compassionate person. And having worked as a hospitalist for the past 10 years, I think I take a more aggressive approach to the management of chronic medical conditions. By aggressive, I mean good outcomes. I'm very firm in managing blood pressures, diabetic screening, and preventive health.
My name's Eric Koenig. I'm a family nurse practitioner here at Hatfield Medical Group. I've been practicing now for 7 years as a nurse practitioner. Prior to that, I've worked 15 years as a registered nurse in the Banner Health System. With my previous experience as a registered nurse, I've seen a lot of patients in the hospital and kind of what disease processes do, and kind of got burned out, if you will, with that. And I wanted to make a difference and try to keep people out of the hospital and make a difference on that primary care front. So that's why I decided to go back, make that transition from nurse to provider. I think what patients like most about me is, with my nursing background, I really focus on education. I make sure that they understand whatever that disease process is, that medication, whatever the course is that we're dealing with, and I just make sure that I give them that time that they need and that they feel satisfied. I'm honest, open, transparent in what I'm going to do, and that's what they seem to like most about me.
I'm Dr. Devin Han, practicing at Hatfield Medical Group. I recently completed residency in Tucson, Arizona, and currently a board-certified family medicine physician. So my staff and I are committed to providing the best care and aligning our goals with our patients' goals so that they get the best care. I don't want to impose my own priorities on them. I want to use evidence-based medicine to help them make the best decisions and then support them in those decisions so that they get the best results. I try to find physicians in the community, specialists who can support our point of view in helping keep you safe and healthy. If there was something that I'd want patients to know about me, it's that I am here to serve them, and I want to present evidence-based medicine to them and then let them make the decision. And then as a team, we can make goals to help you be both happy and healthy.
My name is Dr. Matthew Millett. I've been practicing medicine for 12 years. A few of those were with the military before being with Hatfield Medical Group. I've been with Hatfield for 3.5 years. I'm bilingual. I speak Spanish. I lived in Mexico for 2 years. And so I'm comfortable hablando español con los que hablan español. Primary care is my passion. So primary care, if it is done right, will lead to the best outcomes. The patients are going to feel better. They're going to be happier and be able to lead the lives that they want to. I have a very optimistic approach with every patient. We can always make things better. We can always improve. I start out that way with every patient and every interaction. I want to make a positive one. So I look forward to seeing my patients. So every time I see them, it's kind of like seeing an old friend. I think we managed to have a very family atmosphere. Everybody knows everybody else, and we're concerned about, again, getting things right for the patients.
I'm Michael Riding. I'm a physician assistant with Hatfield Medical Group. I've been practicing with Hatfield Medical Group for about 6 months and practicing overall for about a little over a year. I feel like the patients appreciate the most about me and the care that I give is I try to stay pretty attentive to whatever their needs may be. If they come in with 5 or 6 different things or questions they've got, I try my best to hit all those points and make sure at the end of the visit I follow up with them and say, hey, did we answer all your questions? Is there anything else that we can do for you? I'm always trying to make sure I end the visit kind of with that question to make sure we have covered everything, because a lot of our patients, it's a lot of effort to come into the clinic, and so I want to make sure that they're getting everything taken care of that they need. And so that's one of the things I feel that I kind of bring to the table, and what my patients appreciate. Also that, I'm a listening ear. If whatever there's on their mind and whatever they're kind of feeling at the time, that when they come, they can know that I'm going to take them seriously, and I'm going to try to figure out the best thing we can do for them in terms of their treatment plan, and to find a solution that'll help them to get better and to feel better, and that when they come, they're going to have my full attention. I'm going to put in the best effort to make sure we got the best course of action for them. And I try to do my best to be a smiling face and somebody that they can trust and enjoy coming to see. I mean, it's not always fun to come to the doctor, but hopefully when they come here, they feel like, they're going to be taken care of.
My name is Sharon Catorial. I'm a nurse practitioner. I've been in healthcare over 20 years. Came from Philippines as a registered nurse here in the United States back in 2001, and then shifted into nurse practitioner in 2018. And then I've joined Hatfield Medical Group just this March, and it's been awesome. I like working with the Hatfield because it matches or it aligns with my personal value, and that is to deliver quality, compassionate, excellent patient care. So I try my best as a primary care provider to give them thorough care and to give them the feeling that I understand them, give them empathy. Patients do appreciate it when we do give them our attention and time, and we try to listen to them and address their concerns. And a lot of times they walk out of the door and say, "Thank you for listening and thank you for being thorough."
My name is Talmadge Lewis. I'm a physician. I've been with Hatfield Medical Group the last 20 years, as long as I've been a physician after finishing residency. Primary care is important to me because as a primary care doctor, I feel I am on the team with the patient to help get them the best possible care they need. Success for me as a physician is a patient who's happy and healthy. I've got some patients that are sick. One patient in mind was visiting the emergency room at least a couple times a month. So I sat down with her and I said, "Look, you're going to come see me every week until we get your health conditions under control." Over the course of a few months, we were able to see her now monthly, and she has not visited the ER in that time. She actually told me that the last visit she thanked me and said, "You're the first doctor that's cared about my health. I appreciate that." And that is success to me.